nasty.
Have you ever seen the white part over a red piece of meat? So that's fascia. What it helps, it helps the muscles articulate. Over prolonged periods of tension, basically becomes very thick and is a knot. I like to put anybody that's getting acupuncture on herbs as well. Herbs are a really good way to basically give the body something it doesn't have. And there's a very specific 10 questions that acupuncturists ask. So these 10 questions are going to help us create your pattern diagnosis.
Wax on, wax off. I know many of you have seen in The Karate Kid, Mr. Miyagi using cupping to heal his leg when he went back in there and whooped Cobra Kai's butt to win the championship. Well, today we have the specialist on Eastern medicine. We have Dr. Vanessa Horning. She is here to explain what acupuncture is, what cupping is, what Gua Sha is, and she really breaks it down and explains these alternative forms of treatment to help you recover and heal from your pain. If you're interested in all at Eastern medicine and you want to learn about Qi, Yin, Yang, and you want to learn about the energy flows within your body and how doing these different techniques can help you heal, then today is going to be the episode you want to chime in for, and you're going to learn a bunch. Vanessa is lovely. This is going to be a great episode, and please listen on in so that you can hear about how Eastern medicine can help you or your loved ones. So hello everyone, and welcome back to another episode of the Nasty Truth podcast. Today we have Dr. Vanessa Horning here. Dr. Vanessa is a specialist in Eastern medicine, and I'm going to go ahead and introduce her. Dr. Vanessa graduated from Southern California University of Health Sciences with a doctorate degree in acupuncture and Chinese medicine, with a concentration in fertility and reproductive health. She has done further study in Taichung, Taiwan, at the Changgung Memorial Hospital, and has volunteered with many charities to bring acupuncture to underserved communities. Dr. Vanessa has also treated at the Oncology Center of Hope and Innovation in Whittier, and she has a drive to combine ACU with evidence-based medicine. Her passion has allowed her to conduct various studies, including research presented to the American Public Health Association on her work on acupuncture and its benefit for migraines. She has also conducted a prospective case study for effects of acupuncture on smoking cessation, and she is currently the co-owner of Horning Chiropractic and Acupuncture in Laguna Hills. And she is also the designated acupuncturist for Tactical Sports Medicine Department and assistant professor at SCUHS. What does SCUHS stand for?
Southern California University of Health Sciences.
Fantastic. Yeah. So
Yes.
Vanessa, thank you so much for being here today. I really appreciate it. I'm excited to chat with you today about Eastern medicine, kind of dive into the different types of procedures that you do on a regular basis, and, go over everything from, let's talk about soft tissue therapy to acupuncture, cupping, Gua Sha. I really want to dive deep into what it means to do Eastern medicine and the work that's involved with helping patients heal.
Sounds good.
Okay, awesome.
I think we can cover that. Thanks for having me,
Of
by
course.
the way. It's a
Yeah.
lovely view.
Yeah, no, it's not too shabby. There's definitely worse views in Newport Beach.
Absolutely.
Yeah,
No, good
we
job.
went from my old office was right on the water, which was cool, but I like the upper view. I don't know, I've always been like this type of individual, and it's cool. It's got nice things to look at. You can see Irvine over there, and it's pretty awesome.
Yeah,
So thanks for coming by.
Absolutely.
So we're going to start today, and so like I was saying, we're going to go ahead and get back into this. So in regards to Eastern medicine, so what does Eastern medicine per se mean? Let's go from like a bird's eye view kind of point of view, and then we'll dive down deep into what are the different specialties within that.
So Eastern medicine is the type of medicine, basically it originated in the East. Actually, about 2,000 years ago, there were turtle shells that actually have Chinese medicine terms such as Qi, Yin, Yang on turtle shells that describe and showing proof that there's history of it way back then. So, and then throughout time, all the different dynasties of China, you see the development of acupuncture and Chinese medicine, and until here we have it now incorporated in the West, modern day.
Got it. So Eastern medicine means that it was developed in the East, such as China or Japan or
Correct.
countries out in
Correct.
that part of the world,
Exactly.
compared to what some might call Western medicine, right? I think many people might even term the term Western medicine more with like pills and stuff like that, and then Eastern medicine is more along the lines of acupuncture and therapies and actually doing the work to get better.
Right. So acupuncture, what encompasses Chinese medicine is acupuncture, the use of the needles, herbal medicine, Gua Sha, which is what we know as scraping, cupping, moxibustion, which is actually the burning of mugwort over particular parts of the body,
Okay.
and soft tissue work, Tui Na, with Chinese medical massage.
Okay, mugwort. That's an interesting term. I'm
Yeah.
excited to kind of get into that. So Eastern medicine. So right now you're a professor at the university that you described earlier.
That's correct.
And how do you like being a professor?
I really love it. I enjoy teaching. And
Yeah?
it's really fun to just share the knowledge that you've gained. It's actually my alma mater. So I just really enjoy taking the lessons that I've learned from my mentors and giving it to future students, future chiros and acus, actually.
What is the specific title of your course?
I actually currently have 3 courses, medical history taking, introduction to physical examination 2, which is more of a Western medical physical exam, and practice management and development.
Okay, and
Yeah.
so you're not only a professor, but you are a practicing doctor at the same time.
Correct.
Okay, and then let's take a step back. So what are the requirements to become an actual? So you're not an MD, or you are an MD, or what is the title after your name?
I'm not an MD. I am a DACM, which is Doctor of Acupuncture and Chinese Medicine. I was
Okay.
actually a part of the first cohort of the DACM program at SCUHS.
Okay.
A lot of doctorates are postmaster's doctorates.
Okay.
The minimal requirement to be an acupuncturist in California or the United States is a master's degree. So if you see an acupuncturist with a doctorate behind their name, just know that they've done extra hours of study, specifically in Western medicine and clinical hours to gain that doctorate, and probably a research project on top of that.
Okay, so let's talk about the schooling that it took just to become a DACM, right? You had to go to undergrad, and then what other schooling did you have to go to?
Basically, it's a 4-year doctorate, and you are thrown into the biomedical sciences. So you take a full curriculum of Western medical sciences as well as Eastern medical sciences, and of course your technique classes of needling and cupping and learning all of those things that we use.
Okay, and so did you have to do some sort of residency?
Yes, we have an on-site clinic, and so during the majority actually of our time there, we are actually in clinic seeing patients, learning how to treat the different things that acupuncture treats on actual patients, and we can. There's different opportunities. Chalk actually has an acupuncture residency, so practitioners that are interested in going more the child or pediatric route can do that. Oncology centers, sports medicine centers, things like that.
Are there a lot of schools that offer DACM, or is this more like a specialized area that's only offered in certain universities?
It's a fairly new thing to be able to go directly into a doctorate program without the master's degree. So there's 2 programs. You can have a DAOM, which is Doctor of Acupuncture and Oriental Medicine, and that is your postmaster's doctorate. Or you could get a DACM and go straight into the doctorate program once you've finished undergrad.
Okay.
So there's a way to eliminate that master's degree, if you will. But you do have different letters behind your name.
And when you say it's relatively new, this wasn't something that was offered for many years. It just started happening when, like the last 10, 20, 30 years? Is that what you're saying?
Not even. Our class was actually the first class in 2017 to be accredited program for that DACM.
Why do you think this has taken so long for people to give the proper accreditation? You're obviously, doctors that provide a certain type of treatment, and it's something that, being in my field, I am well aware of it, but I think there's many people in the world that are just not even aware of many of the treatments that you provide, right? What is Gua Sha? What is cupping? What is acupuncture? Like, a lot of people, their eyes light up. They're like, I have no idea what you just said to me, right? Their probably experience is probably limited to Mr. Miyagi doing cupping to Daniel-san and the Karate Kid, and that's probably the only time that they've ever seen it or even heard of it.
Yeah, right. Well, it is slowly making its way into the West. It's slowly being recognized as a legitimate science.
Yeah.
in the West, they're starting to recognize it mainly for pain.
Yeah.
Post-surgical nausea, there is a lot of evidence for that as well. So basically in the West, is there evidence for it? How many articles are there that say it has good efficacy?
Yeah.
So that is what matters a lot in the Western thinking.
It's like studies or articles.
Studies,
reviews.
articles, how legitimate is it? And it's, in places such as Taiwan, China, Japan, Korea, where it's already a part of their medical system. They've been using it for thousands of years, and they don't necessarily they see that it works. It does work. They don't need 20 studies to prove that it works because they're up against a large Western medical system.
It's been up since the dawn of time for them. It's not really something that they're worried about whether it's efficient or not. In the U.S. we have to prove everything in every type of way, but this is just something that's a part of life in the Eastern world. Yeah.
So I actually think it's making good stride. Acupuncture wasn't legal in California until 1976.
Legal.
Until 1976. Dr. Miriam Lee, she's a PhD from China. She emigrated from China to California, and she actually spent some time in Vietnam. That's where she picked up her skill of acupuncture. And she came to California, and she was a factory worker, and she knew the skill of acupuncture, so she was kind of treating patients in her house secretly on the down low until she was caught practicing without a license.
Oh, what?
So she went to court. Then she had a whole bunch of patients come to her court hearing saying, no, this is the only medicine that has helped me. This woman has fixed me. She's basically advocating for her and not wanting her to go to jail. So it was because of all of the patients that had seen success with acupuncture and advocating for Dr. Lee that Ronald Reagan actually made it an experimental procedure. And then Governor Jerry Brown in 1976 actually made it legal. So at that point she was licensed, and she gained her doctorate, I believe, in the 80s.
How interesting.
Yeah.
It's like almost been a struggle.
It's been a huge
it's almost
struggle.
like a movement, right? Almost like its own like civil rights movement. It's like, hey, we're just providing, the answers to the questions that are out there.
Exactly.
And you guys are seeing them almost as criminals, for practicing something that you don't understand. And right, a lot of times in life, it's just because people don't understand, their immediate reaction is just to shut it out or to stop it instead of actually give it the opportunity to come to fruition. But at least now, even though it took so long, right? We're in the late 1900s. It's not like this information is just coming out, but it's taken this long for it to become an accepted practice. And you're saying that just recently we are now allowing people to get degrees in it when it's something that's been established for thousands of years all over the rest of the world, except in Western medicine is the only place that they're behind in the times.
Correct. And actually early in the 1900s, because of the influence on the West, it was actually banned in China. Chinese medicine was banned in China. And
because of the influence that the West has on other places of the world?
Correct, because China had such a difficult, there was civil war in China, basically, and because of this internal weakness of the culture, the West was able to come in and show its side of things.
Oh, wild.
So actually Chinese medicine was banned, and it's slowly, like I said, made its way. So I actually think we're doing pretty good considering the struggles that it's gone through.
Yeah. And so what exactly got you into Eastern medicine? Why would, most people are like, I want to be a doctor, I want to be a surgeon, right?
Mm-hmm.
But you, at some point, you were like, no, I want to go down the Eastern medicine route, and that's what you started doing.
Right. Well, I have very progressively thinking parents. They were always going to an acupuncturist. My mom actually helped in the Chinese herbal pharmacy, and so I was always around it, always in it. And when I realized I didn't have to go to a mountaintop in China to learn from a monk how to do acupuncture, I decided that, I found out I could just do it here. That's what I did.
That's amazing.
Yeah.
That's really cool. That's awesome that your parents supported you, right? Many
Yes.
times. I know my sister, she's studying Eastern medicine right now, and my parents wanted to, strangle her when they heard that was going to happen. They wanted her to go be an MD.
Sure.
And she's like, and once again, I am very familiar with it. I treat with you on a regular basis, and I've seen the benefits of that. And, when it comes to these types of treatments, they work, right? And a lot of people don't realize that just getting better, it's not sometimes the quick solution of taking a painkiller such as a Norco, or taking, or going in and getting a procedure done. Sometimes it's you just want to let your body heal naturally, and that's what Eastern medicine does, is it helps promote that natural health, correct?
Correct. Yep.
Okay. So now that we've kind of gotten a little bit of background, we understand the struggles that have happened to get to where we are today.
Yeah.
Let's talk about what is acupuncture? Okay, where did it start, or if you have some of the background that you've given us kind of today about your field in general, I would love to kind of just talk about acupuncture and do a deep dive into that.
Okay. Yeah. Well, acupuncture itself is the use of needles, and there are hundreds of different points on the body, and after a thorough diagnosis, history taking and diagnosis, we then determine what point prescription would be best for you in your condition. So from there, we take our acupuncture needles and insert them directly into the points that we've determined are best for you and your condition, and the needles do the work.
Well, time out. Let's go back. What is a point?
There's a lot of theory on that. There's actually been no scientific evidence of what an acupuncture point actually is. To be honest with you, I'm not sure how they came up with all the theories behind the points. Some of them there are what we call meridians. You think of meridians as freeways, pathways. Each organ has its own freeway. Okay, a heart has its own freeway, stomach, etc. has its own meridian pathway. And so there's energetic flows of that particular organ throughout the body. And on these, on the freeway, there's little exits, if you will, and those exits are the points. And that is where particular energy comes together. Each point has its own indication, what each point does, why we use it. But to give you a direct Western medical correlation, they have yet to find one.
Okay, so let's talk about, let's say maybe a point coming from your heart. So let's do like an example. Let's say that my heart's here. So my heart, there's points that come out of it, or there's a bunch of points like meridians or freeways that lead out from the heart, correct? Is that right? Or is there more just like a very small limited amount that comes directly from the heart?
Well, it's actually, a lot of the channels flow from the top of the body down to the feet.
Okay.
So the heart channel actually starts on the finger and comes up under the arm.
Okay.
And goes in this direction and kind of meets in the axillary line, right, kind of like where your armpit is.
Okay.
And
what does axillary mean?
Axillary is kind of like where your armpit. So if you take your armpit and you divide it in three, you have anterior, mid, and posterior axillary lines.
Okay.
Yeah. So
Okay.
it's just anatomical.
Okay, and so you said that it goes from the bottom, like here, or the bottom of my arm, it goes...
And then it travels, okay?
Okay.
And then you have your points, okay? You have heart 7, heart 6, heart 5, and heart 4.
So you have 4 points in the inside of your
just
arm.
on the side of your wrist. And I actually use these points relatively frequently for patients with difficulty sleeping. Like I said, each point has its own indication. So depending upon what you have going on, I'm going to use a particular point.
Okay, so what do you mean by an indication?
Indication is what that point does.
Okay.
This point helps you with sleep. This point helps you with nerves. This point helps you with whatever else.
Okay, so when you put an acupuncture needle, into the point, you are saying it will have a direct effect on that specific indication of what that point does.
Correct. Yeah.
Okay. So let's just use this as an example. So let's say that it's the point for like insomnia, right?
Yeah.
And you say that this point will help me sleep. What exactly does putting a needle into that point do to help me sleep?
Well, we believe, we speak in terms of qi, blood, yin, and yang. And if there's a particular reason there is a deficiency or there's an excess, we're going to use that point to basically fix that deficiency or move the qi on that particular channel in order to be able to fix your condition. Yeah.
Okay, so what were those terms one more time? Qi, blood?
Qi, blood, yin, and yang. So in Chinese medicine, we talk in elements, right? So we look at you, we look at your, when we want to diagnose you, we look at your tongue, okay? And we also take your pulse.
Okay.
And after asking you a whole bunch of other medical history, taking questions, I'm going to determine, well, Joe has, heart qi deficiency.
Okay.
And then from there, I'm going to use the points to basically open up the energy channels on that pathway to help you sleep better.
Okay, got it. And what does qi mean?
Qi is, there's a rough interpretation as energy flow, the life force. Western medicine, nitrous oxide, which helps the blood circulate within the vessels.
Okay.
Yeah.
Got it. And it's not specifically like electrical stimulation from like the brain, because we have electrical signals going through our entire body. That's not the same.
It can be.
It can be.
It can be. Sometimes it's very difficult to completely translate Western into Eastern medicine. There's no real direct correlation, which is why Western medicine practitioners can get frustrated with it.
Of course. So basically, qi can almost be described as the energy flow within the body.
Right.
Is that
Yeah,
correct?
exactly.
Okay, got it. And then yin is the other term?
Yeah, yin.
Yin.
Y-I-N,
Okay, yin.
yeah,
Like
yin.
like yin yang, right?
Exactly.
Like, okay, so and then it's not yin. You said yin yang though, right?
That's the correct.
Yang is a
Pronunciation.
so okay, so that's great. So I'm learning. So yang is actually the proper way to pronounce. Yang is pronounced yang.
Right.
Understood. Okay, so it's yin yang.
Yeah.
Okay, and so what does yin yang stand for particularly?
Yin is everything cold, everything dark. Yin energy is very calming. It's feminine energy. And yang is hot energy. It's heat. It's fast. It's masculine energy.
Okay.
So the two come together, and they need one another. And you've seen the yin yang sign,
Yes,
right?
they're blending.
They're blending.
Yeah.
One needs the other in order to work properly. So if you have one that's not working properly, there's going to be an imbalance in another. And so in TCM theory, Chinese medicine theory, we use the yin yang to diagnose and then balance so that you feel better.
So you will almost try to balance those heat and the cold.
Correct.
Because balancing the heat and the cold will lead to your qi being more imbalanced and the energy flowing properly.
Exactly.
Yeah, and the term that Western medicine probably uses just you help with blood flow or getting the blood to flow properly, which is technically your life force energy or that would be them trying to almost like define it, correct?
Yeah, right. Because there's qi and there's blood. We have both. Okay, so not only do we have blood, but we also have the qi. What gets the blood moving? You know? So that would be the qi.
Yeah.
Right.
Okay, very interesting.
Yeah.
Wow. Okay, thank you for the explanations.
You're
I
welcome.
appreciate that. Okay, so these needles, right? When you see procedures many times, sometimes people will put in a couple needles, sometimes people will put in, on the entire body, but you're saying it just depends on what's in pain. So let's take people back to the beginning. So somebody comes to you, they're in pain, right? Or they're having symptoms and they're having issues. They've tried pills, they've tried other procedures, not working. So now somebody recommended them, go try Eastern medicine. What does that initial evaluation look like from you? And what exactly are you asking? What are the questions you're looking for? Let's take people through that.
So a patient comes in, say they have a shoulder injury.
Yeah.
Okay. So I'm going to ask them routine medical questions, get an idea of who they are as a patient, what their past medical history is, any previous injuries, any other conditions they might have. And then I'm going to ask them, there's a very specific 10 questions that acupuncturists ask. And these 10 questions are very specific to our diagnoses, our ability to determine, well, do you have a qi deficiency? Do you have a yang deficiency? Yin, blood, bringing in those components again. So these 10 questions are going to help us create your pattern diagnosis. And we call it pattern diagnosis, like I said, that heart qi deficiency or the kidney yin deficiency. So that's where the elements come in. And so we use those 10 questions to come up with a diagnosis for you. So a patient with a shoulder injury.
What are those questions? Sorry, is that going to be a much longer conversation?
No, yeah, it's okay. I'll just give you an example.
Yeah.
So something that acupuncturists ask that might not seem relevant to what a patient has going on, but it's very important to know for us is, do you sweat? What's your sweating pattern like? Do you sweat from your hands and your feet? That gives us interesting clues into who you are as a body, your physiology.
How interesting.
Headaches, eyes, your abdomen, digestion.
What about your abdomen? Just is it sore?
Just anything in regards to, your heart, your digestive organs, things like that.
Okay.
So the trunk, we want to know everything that's going on in there. Your digestion, your bowel movements, your menstruation. If you're a female, I don't care what you're coming in for. I'm asking you about your menstruation or your female history.
Yeah. And menstruation meaning their period. Correct?
Yes, correct.
Okay.
So there's just in your gynecological history. So people are going to ask, well, why are you asking about my bowel movements? That has nothing to do with my shoulder injury.
Yeah.
But it does, because it tells me how your body's functioning as a whole.
Yeah.
So depending upon how your body's functioning as a whole unit, that's going to give me a better idea as to, well, why are you prone to shoulder injuries? Are you just getting old? Do you have arthritis? What's going on inside your body? What pattern do you have inside your constitution that's telling me you have a weakness? Even if you got an acute injury from a car crash, now you have shoulder impingement in your arm, and that's creating pain. Okay, fine. But let's talk about what you have going on underneath and why your shoulder was more inclined to injury. So it could be for things like musculoskeletal, you can have qi and blood stagnation. You can have a blood and yin deficiency, liver, kidney, yin deficiency. So depending upon those 10 questions, it's going to let me know which pattern diagnosis you have for your injury. So a patient you have 3 different patients with shoulder impingement syndrome. Well, this patient has qi and blood deficiency, this one has liver and kidney yin deficiency, and this one has a different pattern diagnosis. So it depends. So that's going to determine which points I use. Not all 3 of those patients are going to have the same needles, even though they have the same injury, so to speak.
Understood. Okay, I really appreciate you breaking that down like that. Now I can understand. Yeah, so you're looking for information that we might not find on our own, but you knowing whether some parts are not working better than others or
Correct.
other issues that the body is having might tell you that this might actually be the cause, or you should try and treat that to see if that's going to help resolve the issue, right? Because sometimes my shoulder problem might not be a shoulder problem, but it could be that I'm having issues somewhere else that's leading me to act strange with my shoulder or do something in an efficient manner.
Right, to give you a tendency as to why you have an issue in that region.
Okay,
Mm-hmm.
Very interesting.
Yeah.
Okay, and so the needles go into, so the meridians, are they essentially blood vessels, or are they not always blood vessels?
That's one of the theories. See, like I said, Western medicine's always trying to find the direct correlation with Eastern medicine.
Yeah.
Sometimes you can't find it. So there's theory that it follows blood vessels, follows nerve endings, follows fascial lines, fascial planes. And a lot of it correlates, some of it doesn't. So we default to our Chinese medicine theory at that point and go with what we know it is from that theory. And sometimes patients want to know exactly what's going on, exactly what's happening. And I tell them there's a lot of money that's spent trying to study exactly the direct correlation. Sometimes you can't find it.
Got it. Okay, so, it's very much like, I've done like some research in regards to alternative types of treatments, right? And they show treatment that deals with, like, for example, sound, and right, certain sound frequencies have effect on people's bodies. And definitely there's healers out there, not doctors per se, but healers that heal with energy, right?
Correct.
And so it's almost like understanding that there are sometimes other forces. It's not always just straight medicine, but there are ways to heal the body, and there are ways to get better, whether it's through energy, sound, or different frequencies. And this is kind of one of those things where it doesn't absolutely have to correlate that the needle is going in a certain place, but there is energy that flows there and gets stored there,
Correct.
and it can be released through these needles.
That's exactly correct.
Okay. Got it. Okay, so I'm glad I understand that. Okay, cool. And so these needles, from what I've seen, they're different shapes and sizes, correct? And they will go in at different depths. Can you kind of go into that a little bit for us?
Sure. So the needles are sterile, one-time use. They are not reused. It's illegal. If you ever see an acupuncturist reusing needles, get out of there. Don't do it. But these needles, they range from about 26 to about 40 gauge, which is very, very small. You can actually take 40 acupuncture needles and put it in one hypodermic needle. So
that's what that means. 20 to 40 gauge, you can put
they're very small. So the
very,
bigger
very
the
tiny.
number, the smaller the needle.
The bigger the number, the smaller the needle.
Correct.
Got it. Okay.
So so I on average use about 30 gauge usually, and the needles, depending upon the body part, that's what size of needle you're going to use. So if I'm working on a glute muscle, I'm going to be using maybe a 3 or 4 inch needle. But if I want to stimulate someone's scalp, I'm going to use a very tiny hand needle, probably about 1 centimeter long.
Got it. And that's because you need to go deeper, like on my glute, which is for anybody out there, that's my butt per se, right? So like you need a much deeper needle because to get to the actual meridian lines or to get to the muscle or wherever you're trying to work on.
It's just a bigger area.
You got to go deeper in there.
Yeah.
Okay, understand.
It's how much muscle is on the body in that particular region, basically.
Got it. Okay, so like same thing, even if it's like on the bicep per se, you might use a bigger needle than what you'd use on the scalp, which is just a very tiny little layer of skin. You don't have to go very deep there at all. Okay.
Yeah.
Very interesting. And so, are there techniques? I've heard of techniques, but like I would love to hear from you, like techniques where you can go in and break apart like scar tissue or fascia, and maybe we should explain to people what scar tissue and fascia is first before we talk about that. You know, what exactly is scar tissue and fascia, so people can have a basic understanding.
So scar tissue is the very thick layer of skin and fascia that has come together to heal itself after an injury.
Okay.
So if you had a surgery, if you had something removed from your skin and you needed stitches, that skin is going to come together and create a scar, which is just thickened tissue, basically.
Okay.
Fascia is, have you ever seen the white part over a red piece of meat?
Yeah.
Okay, so that's fascia. What it helps the muscles articulate over one another. So if you have an injury or constant hypertonic muscles.
What does articulate over one another mean?
Move around.
Okay, got it.
If you have constant hypertonic muscles from stress or an injury, or the spinal nerves are not sending the right signal, those muscles are going to tense up. So over prolonged periods of tension, those knots or that fascia comes together and it basically becomes very thick and is a knot, makes a knot.
Okay, got it. And so you're saying when you get injured or when you get hurt or if you get a surgery, right, if some trauma, let's say, to the body, right, that's internal, your body will naturally try to heal itself, and it doesn't always heal itself in the prettiest fashion or in the perfect way. And so its way of healing itself is to use scar tissue and to heal as quickly as possible. And many times it will not heal in the same original form that it was before.
Correct.
And so this bunched up scar tissue called fascia or scar tissue, is it sometimes called fascia? No, fascia is not what scar tissue is when it's healed and it's healed improperly. And so that scar tissue can impede on blood flow. It can cause issues internally. You basically it's
decreased range of motion. Yeah.
Got it. And so after surgery or after a major trauma, it's important for you to make sure that scar tissue has properly set or it's properly healed the right way, right? And somebody like you, an Eastern medicine specialist, is really going to be the best person to go to. Or I know that they have some surgical procedures where you can clean up scar tissue, but obviously surgeries, you want to avoid that if you can. But somebody should come to someone like you after a major procedure and see if you can help with that.
You can. If it's very thick or chronic or deep set, sometimes surgery is the standard of care for that.
Okay.
But as far as, dermal scars, acupuncture is really good for surface layer scars. Someone has had a C-section or has something on their back. So you can actually use acupuncture needles, and we do what we call surrounding the dragon being the scar.
Okay.
And so we can go around and, break up the scar tissue doing that.
And does the needle itself break up the scar tissue underneath the skin?
Yes.
Okay. And on top of that, it promotes blood flow, right? Which is many of these treatments is to improve blood flow, which moving the blood flow is improving the energy right around it, and then naturally your body will heal it.
Yep.
Got it. And so acupuncture will stimulate blood flow, which will help your body just get back to normal. Okay, got it. Okay, understood. Okay, so acupuncture. Is there anything else about acupuncture that you'd like that you feel like we should know, or something that many people don't know and is kind of like a misnomer about it?
Well, Just that one of the things I get asked a lot by patients, and they have a lot of trepidation over when they come for their first appointment, is, does it hurt?
Yeah.
They're scared that it hurts.
Yeah.
I even have men with tattoos scared of acupuncture.
That's funny.
My answer to them is, everyone has different levels of pain. But as a rule, no, acupuncture does not hurt. There are parts of the body that are more sensitive than others. The hands, the feet, the legs can be sensitive. But as a rule, no, acupuncture does not hurt. And I personally am very cognizant as an acupuncturist. I'm able to read my patient. If my patient is very scared, they're very nervous, I'm going to use a slightly gentler needle for them.
Like a thinner needle, so a
thinner
higher
needle,
number.
yeah. Then I would, a seasoned patient who, I can give thick needles to and they love it. And as a matter of fact, if I don't give thick needles to them, they're going to complain about it and be like, well, I don't feel anything. So it depends on my patient, to be honest with you, what needles I use. But I am extremely cognizant of looking at my patient and seeing their fear level and letting them know that it is okay, because as an acupuncture practitioner, I'm responsible for the reputation of acupuncture because it is just making its way after so much history of struggle. So I need to be extremely cognizant of that reputation and know that I represent the field and that I need it to make it a good experience for people.
No, 100%. I mean, like I said, I've done acupuncture too. It feels like a little prick. It does not hurt in any way, shape, or form. So you're absolutely right. It's not painful. I think a lot of people are just scared. I mean, I'm a fainter myself. Whenever I get like needles, or if I get like an IV, I pretty much faint every single time when I get blood drawn. So, but with acupuncture, I don't faint. It's not the same thing. It's a very light like prick, and usually you're going to be laying down. Your eyes are going to be closed.
Right.
You're not going to be sitting there watching the whole entire procedure. You're there to get treatment. You're not there to stare at it and make sure that they're doing their job correctly. You got to trust and let the doctor do their job. Exactly.
And most people find it to be relatively relaxing. It's a nice time. I encourage people to meditate, be zen, and it's their time. And so as long as they can get past the does it hurt fear, it's usually a really good experience.
Okay, very cool. All right, so we've talked about acupuncture. We know what acupuncture is now. I want to talk about what cupping is. And like I said, for those of you out there that don't know what cupping is, we're going to get into it, but the last time you probably saw it was the Karate Kid with Daniel's son, and Mr. Miyagi came on and did a little bit of cupping on his leg, and then he was able to get back out there and, win the tournament. So let's talk about what cupping is, and what exactly we should know about it.
Okay, so cupping, or also called myofascial decompression, is basically an inverse massage. Instead of pushing down, we're pulling up. And one of its goals is to move blood, right? So before I get ahead of myself, there are two types of cups. There's plastic cups and there's glass cups.
Okay.
With the plastic cups, there's a gun. It's basically a suction gun, and you put it on the patient's skin and you suck the air out. It creates suction, and there you have it. Then there's also glass or fire cupping, where you use a flame and you put alcohol on your cotton ball, light your cotton ball on fire, and then you use the flame to actually create a negative suction, and the glass cup sucks onto the skin that way.
So let's describe that. So you put the cotton ball right inside of the cup.
Correct.
And you put it right over the skin, and then you pull it out at the same time.
Yes.
Okay.
So the cotton ball does not stay in the cup, but you quickly put the fire in, pull it out, and then stick it directly on the patient's skin.
Got it. It's just like a simultaneous movement.
Yeah. You have to practice it.
Yeah. You got to practice your ninja skills. Absolutely necessary. Cool.
Yeah, don't burn the patient. That was one of my mentor's favorite sayings. Don't burn the patient. It's like, okay, I won't burn. I still hear his voice in my head telling me that.
Yeah, that's good. Have you burned a patient yet?
No.
Just Dr. Ben?
Just Dr. Ben. No, it's, no. You definitely don't want to burn your patients.
Okay, cool. And so why would you use the glass cupping versus the plastic suction cup if you could do the same thing and lose the risk of burning somebody?
Correct. And this is my opinion. Other practitioners might feel differently. First and foremost, I like the fire cupping because it's a little more traditional, right? there are two types. So we have the two types of cups, and then there's two ways of cupping.
Yeah.
So you have static cupping, which is just putting cups on the skin, or you also have moving cupping, where you're moving the cup, kind of in a massage, up and down motion, like a massage. So what you're going to want to do is determine which one you want by what are you going to do? What's your goal? So if I want to move a patient, move the cup,
Yeah.
I'm going to choose the glass cup because the edges are rounder.
Yeah.
Okay. If I want to give a super concentrated static experience, I'm going to use the plastic cups. The plastic cups I find are a little easier to control because I do have that suction gun and I'm able to just control how much suction I am versus just throwing a flame in and good luck everybody.
Yeah.
So because with the flame, it's not as easy to control how much suction you have.
Got it. But with the flame, it's almost like the same thing we discussed before. It's like energetic healing, right? It's just different. I think with fire and different elements, it provides some sort of, different aspect to it, which I think can be more natural for the body and might even react better.
That's an interesting thought. Yeah.
Yeah. Okay. And so with the cupping, it's the same thing as acupuncture. It's supposed to move the blood or increase the blood flow.
Mm-hmm.
And does that also help with breaking down scar tissue, or is that
Absolutely.
more just like for blood flow itself?
It's good for breaking up fascial adhesions or knots.
Okay.
Yeah, and it's also traditionally been used for if someone has a cold to basically go up and down the back, okay?
Yeah.
And it helps to move around things in the lungs because the lungs are right there, right? So we can use our cups, move it around, and it helps people breathe better, helps people recover faster from colds and things like that. But
So
that's a very traditional use.
Okay, and you said knot. What exactly? Everybody always hears the term knot, right? Can you
Yeah.
please massage my knot out? What is a knot?
A knot is basically so this muscle and this piece of fascia over it goes this way. Then you have another muscle and another covered in its own fascia going this way. So they're created a certain way to do a certain thing anatomically to move around, but if they get hypertonic being stressed or tight, okay, it's going to come together and basically it forms a knot because it's going in two different directions.
And so it's like super tense, and you basically need to relax.
Yeah, you need to relax.
You need to chill out.
So over time, whether it be with stress, exercise, that's what happens.
And if you don't deal with the knot, it will get worse over time?
It can.
It can. Okay.
Yeah.
Got it. What's the worst case scenario with a knot? Like, let's say you never deal with it or get it healed or whatever, you work on it. What would happen?
I've felt knots that are like the size of tennis balls sometime. And although I don't believe that it has any too great effect on the patient,
Yeah.
they can be uncomfortable or like, they have the shoulder pain or whatever, discomfort.
Okay, understood. Okay, so we've gone over cupping. Is there anything else in regards to cupping? I've heard that there's a cupping that they make you bleed during the cupping. What is that exactly?
Okay, so another disclosure statement. If you find a practitioner in California bleeding you out before they cup, get out of there.
Okay, good. That's
First
good to
of all,
know.
it's not legal in California. I don't know if it's legal in any other part of the United States.
Yeah.
It is performed in other countries. Basically, the theory behind that is to get rid of some blood stagnation or some thickened blood that's stagnant literally under the surface, causing pain, decreasing range of motion, whatever other theory they might feel they have for doing that.
Probably the same medieval theory as leeching.
That's exactly what I think. That's what it looks like.
They're taking out the bad energy or bad blood.
Exactly. So the video, I have watched videos of them. They have not been videos made in the United States.
Yeah.
So
I had a client once that did that, and I think the same thing. They went to somebody who was unlicensed, and they wanted to try anything. They weren't getting better, and they wanted to try anything, and they tried that. And I saw the photos of it, and it definitely looks like a very interesting procedure.
yes.
Yeah.
Yeah. I've never done it. I was not trained in it because
Yeah.
it's not legal here. So yeah.
Very interesting.
Mm.
Okay, so in regards to cupping, is there anything else that we have not covered?
No.
Okay, let's go on to mugworts. I want to talk about that. What exactly is mugwort?
So mugwort is an herb. When it is dried and put in a cigar-looking like entity. It is called moxibustion, and it is one of our modalities that we use. So it has a very warming effect on the system. So if a patient has, so again, going back to those elements, right? Say a patient has cold in their system, or pain with cold in it, some sort of arthritis that acts up in the cold. So now our patient has pain in their knee when it's cold, or when the weather acts up, right? We've all know someone who knows when the rain is coming based upon how their knee feels, right?
How interesting.
So that tells us that there is an element of dampness and cold in that arthritis, in that knee or that shoulder joint, what have you. So we use this warming method of moxibustion to help eliminate that cold and damp element inside their injury or arthritic knee.
Okay, and you eliminate that element by bringing the warm energy in there.
Correct.
Okay.
Yeah.
Very interesting. My mom's one of those people. Her back hurts when it's cold.
Yeah.
That's like her thing.
Yeah,
100%.
exactly.
Yeah.
Exactly. So often if there's an injured area, injured back, injured knee, because of the weakness in that particular area, it's very susceptible to the elements.
Got it.
So you can actually develop a sort of arthritis, or we call it B syndrome, based upon the type of elements that your injury was exposed to.
Okay. Very interesting.
Mm-hmm.
Okay, and then you said there's also an herbal side to learning Eastern medicine. What does the herbal side mean?
The herbal side is huge. Aside from all the points, herbs, it's actually the largest part of our curriculum. From term 1 till term 12, you're learning herbs.
Okay.
So first you learn single herbs, then you use combinations of herbs, then you end up in formulas. So we can have Chinese herbal formulas with 20 different herbs in it for whatever particular condition.
And do you provide these herbs to people, or is that a big part of your practice now?
It is a large part. I like to put anybody that's getting acupuncture on herbs as well, because herbs are a really good way to basically give the body something it doesn't have. So we have herbs for pain. We have herbs for stomach issues, anything under the sun, menstrual issues.
Yeah.
And they're extremely, extremely effective. They're in the medical grade system, they're right below prescription drugs and higher than supplements or vitamins. So they're very potent.
Okay. And what are some herbs that you use more often than not?
Some herbs that are very common are things like basic things that you cook with every day: cinnamon, fennel, star anise, things like that. And they have different properties, and they come together, and they create just a healing effect for whatever the condition is.
What does cinnamon do?
Cinnamon's very warming, so I recommend people who maybe have cold limbs, or older persons that are a little more incontinent, and I have decided that they have a yang deficiency. Again, going back to my elements, I've diagnosed them with a yang deficiency. Well, I'm going to give them herbs with those properties to help increase their yang.
Okay, very interesting.
Yeah.
Wow. Okay, so I had no idea that was that. And so when you're in school, do they just kind of take you through each herb one at a time? They talk about its properties,
Yes.
and then you guys are almost like creating potions is definitely not the right word, but you're creating medicine by combining the different herbs into different combinations that will have an effect on the patient in a different way.
Correct. And we actually learn herbal medicine in Chinese. So we're learning a completely different language. Learning Chinese is not required of our program, but a lot of our herbs are learned in Chinese. So often I'll get patients say, hey, what does, let me see, reishi mushroom do? And I'm like, I have to translate whatever that herb is into Chinese medicine, and then I'm able to make that connection in my brain, so to speak.
Yeah.
But so that's just a fun fact that most practitioners of Chinese medicine learn their herbs in Chinese, or what we call pinyin. And pinyin was a language developed by a Chinese man to basically bridge the gap between English and Chinese, so that it's Chinese words in English lettering.
Chinese words in English lettering.
Yeah.
Okay, very interesting. I wonder if it's for like the same reason that some stuff just doesn't translate properly from Chinese to English.
That's true.
Right? You know, I mean, there's some words, so I speak Arabic too, so there's some words in Arabic that just don't translate to like English, right? You have like euphemisms, or you'll have like, you know, analogies or different stuff, so that makes a lot of sense. Very interesting. Okay. So today we've covered Acu, we've covered cupping, we've covered herbology. Herbology is the correct term.
Correct.
Is there anything else specifically within Eastern medicine that we should cover that is something that people might not understand or should understand about it?
Well, there was one more modality, Gua Sha.
Gua Sha, yeah,
Gua Sha.
100%. I'd love to talk about Gua Sha.
Yeah, Gua Sha, it's also called scraping. It's also called blading. I think I've seen it.
Those words sound scary.
Yeah, the chiropractic and physical therapy community is really good at taking Chinese medicine modalities and making it their own. So they've coined several different terms for it. But the proper term is Gua Sha, and basically it means scraping of sand. And so that's where I guess they get the scraping. But basically you're taking, they used to use like soup spoons, but now there's
soup spoons?
Soup spoons, yeah.
Because they're like deeper?
Have you ever been to a Chinese restaurant and they'll give you the longer spoons?
Yeah, like one that's like deep.
Yeah.
Yeah.
So they'll use the edge of that and scrape away at the muscles and etc. But what I use and what a lot of practitioners use are specific tools for that. You can also buy Gua Sha tools in like rose quartz and jade, and some people believe that depending upon what your Gua Sha tool is made of will help implement that property into where you are scraping, so to speak.
It'll have a different healing effect based on the material that you use.
Right, like jade versus rose quartz.
Got it.
I'm not
because
exactly
some stones,
yeah,
they like create certain qualities. Like rose quartz might be a calming, right, effect, or like love and warmth, and jade might be like energy and, you know, vitality or something like along those lines. Right. But essentially my understanding of Gua Sha is that you use the tool, whether it's metal or whatever material it is, to scrape apart the scar tissue or fascia underneath the skin to help the body heal more naturally by promoting same things, increase blood flow, and by helping it go from like if it heals all bunched up, now it'll be more relaxed, and it will let the blood flow occur in a natural way.
Exactly.
Yeah, and you know, I've done scraping myself, and I mean many times you walk away from from cupping, from Gua Sha, like you've been bruised, like somebody beat you up for like 6 hours.
Yeah.
And you literally look like somebody attacked you because your body's all purple and it's blue, and it's because you're really just breaking down the body to allow it to rebuild itself in the proper way.
Yeah, you're breaking up all the capillaries. You're breaking capillaries, and that's essentially why you get all those.
And capillaries are what?
They're little tiny blood vessels.
Okay.
So you're gonna see, you might even see bruising.
Yeah.
You might see, you get that red, raw skin look.
Yeah.
But that's what it is, and you can be sore or it might feel a little burny afterwards, like a sunburn afterwards.
Yeah.
But it's a more aggressive technique than, say, cupping.
Yeah.
They have similar uses. It just depends. When I use Gua Sha versus cupping, I look at my patient, I look at their pain tolerance, I look at their injury.
Mm-hmm.
So there's several different things that I use when I determine whether I want to use cupping or Gua Sha for my patient.
Understood. Yeah, it's very interesting. And then in regards to Gua Sha, how long can a session take, or does it just kind of depend on the injury and what's going on?
Gua Sha sessions, they can take very little time. They can take a lot of time. A lot of times it's how long you can bite the bullet for.
Yeah.
Sometimes Gua Sha is not the most comfortable of procedures.
Yeah.
So it just depends. I work very locally. If my patient comes in with, shoulder pain, back pain, neck tightness, I'm usually just going to work on that and its related structures. But you can do, whole body treatments or, work on the back in its entirety, or it just depends on the muscle group.
Yeah, and typically Gua Sha is for older injuries, correct? You'll use it on something that maybe hasn't healed properly. You're still having pain very later on down the road.
Correct.
And you want, and this is like kind of like, not a last resort, but it almost is a last resort if everything else doesn't work, right?
Yeah, Gua Sha, it's definitely more for like chronic injuries. An acute injury is, so with Gua Sha, we're breaking things off and we're breaking things away. So with an acute injury, the body is still trying to heal itself. So while the body's healing, we don't want to undo all of its hard work. So that's why it is more for a chronic issue. Yeah,
100%. I mean, I can tell you from the work that I've done with Gua Sha, it was on injuries that were very long. They were later on down the road, but it it's not a pleasant procedure. It hurts. So if you guys go into a doctor or an Eastern medicine doctor and you're asking for Gua Sha, be prepared. It is going to hurt like hell, and you're going to come out of it looking like you got beat up, and that's okay, because afterwards your range of motion and your body will start to heal, and you will literally feel during the procedure, you will feel blood. Like if you're, like for example, I worked on my shoulder. When I was feeling the work on my shoulder, I'd feel blood flow to my fingers because it's been blocked up by scar tissue that's not allowing proper blood flow. And when you scrape it up, or Gua Sha, whatever you want to call it, it helps get that blood flow back, which is amazing. So, for anybody out there that's looking to do Gua Sha, it's important for you to make sure that you have a professional that knows what they're doing, because it is very painful, and you want to make sure that they are licensed and they know what's going on, and that typically it's going to be with an injury that you've had little success with other treatment, and this is kind of like a good last resort. But I can say this, Gua Sha works, and it works really well. And for me, playing sports for like my entire life, whether it was soccer or lacrosse or wrestling or whatever, I had all these injuries, and they just kind of accumulated to a point where I was having chronic pain every single day when I would go to the gym or just whatever. And now from working with you, it's gone down to like 90% less pain just overall in all the different places. But it took months of getting these injuries like back in order, and it's not going to happen overnight. And you have to realize with any of this work, whether it's Gua Sha, cupping, it's all work, and you have to take the time and realize it's not going to happen overnight, and realize it's a process, and over time your body will do the work. Give it a chance to do so.
Yeah, very well said. Yeah, acupuncture and any alternative or holistic medical treatment, often, it's not an overnight, fix-all. It's not a pill that you can take that's going to cure all your, things. Sometimes patients come in and like, oh, I tried acupuncture, it didn't work. One of my questions is, well, how many times did you go? What were you working on? Were you dealing with a 20-year-old issue that you wanted your acupuncturist to fix in 2 sessions? Yeah. Probably not going to happen. Yeah. So, with anytime you get acupuncture, if it's an acute injury, expect to go several times a week and taper off. Yeah. If it's a more chronic injury, you're going to go less frequently initially, but you're going to be going for longer. Sometimes it can just be once a month maintenance for quite a while.
And one other comment I want to make too, for any of you out there who have like, oh, I've tried this, I've been to my doctor, I've done this, go to a different doctor who does the same exact thing. Many times one doctor, even though they say they're a chiropractor or a doctor of Eastern medicine, they're going to have a different technique, or they're going to have learned it a different way. Or maybe if they're an older doctor, they just know old techniques. It's beneficial for you to try with another doctor, and that's why people say get a second opinion. Second opinion is, your health is everything. So what's more important than making sure that you're functioning the right way? Sometimes going to a doctor within the same field that does the same thing, you're going to get a completely different procedure, different practice, and it will be the thing that you needed to get better. So just go ahead and explore those options too. I don't know if you agree or disagree with that.
Yeah, no, I agree with you. And especially with acupuncture, there is a wide array of types of practitioners. So you have very, very good practitioners that have been practicing for 30 years. They were trained in China, and they are very aggressive in their treatments. But they're always very, very good, and they have knowledge that us Western-trained practitioners probably don't have. Just because they're learning in the root of where the medicine was developed, and there is no translation issue because they're actually able to learn in the language that the medicine was developed in. However, that doesn't always fit everybody. Some people sometimes there's language barriers. Sometimes there are the patients that are scared of needles, and maybe a more traditional practitioner is not the right fit for them. Maybe they need someone who is cognizant of, well, what size needles am I going to use for this patient? Someone who's a little bit more aware of a Western patient's needs. So it just depends. With acupuncture, you have, like I said, you have Western trained practitioners and you have Eastern trained practitioners, and they can vary quite a bit. We're trained in the West to be a little more delicate, and we're not as aggressive with our treatments. So a lot of times the thought behind that is you don't want to make your patients angry.
Yeah, 100%.
You want to be very kind to your patients, so a lot of times you're going to be very delicate with them. And we have that kind of in the forefront of our mind in the West.
Awesome. Very cool.
Yeah.
All right. Well, Vanessa, thank you so much for coming in today.
You're welcome.
I really appreciate it. You've given us a lot of information today on what it actually means to be an Eastern medicine specialist, the different types of treatments. And what I'm going to do right now is I want you to please give everyone your contact information. If anybody just has questions about Eastern medicine, or if you're looking to get treatment, you can reach Dr. Vanessa, and she would be more than willing to help you out and give you the information that you need.
Yeah, sure. So my office is located at 25241 Paseo de Alicia, Laguna Hills, 92653. My office phone number is 949-422-7698, or you could shoot me an email at drvanessa@drbenhorning.com.
Cool. Awesome. Thank you so much for being here. We appreciate you guys tuning in. Have a great day.
Thank you.
Nasty.